privilege of health, inequity in healthcare. Do you feel that health should be a privilege? In our modern society, there are advancements in science, research, and practice that allow healthcare and contemporary medical practices to improve. New technology, less intrusive surgery methods, and best practice approaches in everything from obstetrics to hospice care are on the horizon each day. For the lucky few. Are you one of them? In the privilege of health, inequity in healthcare, we'll explore the following topics. An introduction. What is socioeconomic and social inequity, and how does it impact healthcare? Davis's story. How gender discrimination impacts the quality of care for some individuals. Lifelong health. The importance of quality health care from birth. Big problems. How Medicare in the United States is failing. And proposed solutions. What is the plan for improvement? So, what is inequity, and how does it impact healthcare? In the dictionary, inequity is defined as lack of fairness or justice. In this slide, we'll examine it related to just one factor alone, income. We'll examine mortality amongst different socioeconomic groups. Remember, that doesn't include how race or gender impact inequality when it comes to discrimination. If you look to the chart on the left, you'll notice income inequality and mortality in 282 metropolitan areas of the United States, as displayed in a graph. The following graphic illustrates the differences in the death rate per 100,000 people based on their per capita income. Money equals health. Income inequality is regarded as an important driver of health status in industrialized nations. Health services in our society can rightfully be thought of as a commodity. Those with more money can afford more services. Despite recent changes in our country, the United States is still trailing behind the success of other countries with government-funded or socialized health care, which is the most successful by far in many areas statistically. For example, if we examine the infant mortality rate, in 2013, per 1,000 births, we find that the United States on average has a death rate of 5.9 infants. Sweden, socialized healthcare, 2.4, and France, another country with socialized healthcare, has an infant death mortality rate of 3.5. As you can see, more poverty equals more death. The more economic hardship that a country faces, the higher the mortality rate is. Unfortunately, in Sierra Leone, a coastal West African country, there is an average of 100 infant deaths per 1,000 births as reported in 2013. But that's not the whole story. Though the CDC gives an average in 2013 of around 5 infant deaths per 1,000 births in the United States, when we examine solely African American births, we find that number more than doubles in size. The African American infant mortality rate, 11. Again, the American average of all races combined, 5. This is an example of the racial inequity as compared to the infant mortality rate.